The fax machine is the bottleneck in US healthcare, and VCs are starting to. The consensus read is already outdated. What matters now is the second-order effect most commentary still ignores. We will map trigger, incentive shift, and downstream impact before the close. 40%. That's the bottleneck nobody talks about because it sounds absurd, but it's not a joke, it's infrastructure. Every referral, every lab result, every specialist consultation gets manually faxed between hospitals, clinics, and insurance companies. And while the rest of the world moved to cloud systems, healthcare stayed stuck in 1985. Here's why this matters right now. VCs are suddenly funding the companies that fix this. Why? Because the problem isn't technological, it's regulatory and operational. Healthcare can't move faster than its slowest system, and the slowest system is a fax line at the bottom of a filing cabinet. Let me break down what's actually happening. A patient needs a specialist referral. Their primary care doctor writes the order. Someone in the office manually faxes it to the specialist. The specialist's office receives the fax, manually scans it, enters data into their EHR, and calls the patient back, 3 to 5 days later. Meanwhile, the patient is waiting. Meanwhile, the patient's condition might worsen. Meanwhile, the hospital loses revenue because the appointment never happens. This isn't just inefficiency, it's a revenue leak. 40 to 50% of specialist referrals fail because of coordination delays. That's billions in lost healthcare spending, and more critically, it's patient harm. Someone who should have seen a cardiologist last week is seeing them next month. Why hasn't this been solved? 3 reasons. First, healthcare is fragmented. Thousands of independent practices, hospital systems, and insurance companies, they don't share data. Second, regulation. HIPAA compliance made healthcare paranoid about digital systems, so they defaulted to the one thing they knew, paper and fax. Third, inertia. If a system has worked for 30 years, hospitals don't see enough ROI to replace it. But something just shifted. Over the last 2 years, 3 things happened. Electronic health records became mandatory in most practices. Reimbursement models started penalizing delays. Medicare now docks payment if referral to visit time exceeds 30 days. And hospital systems got tired of losing money to coordination failures. That created a market. VCs are now funding the intermediary layer, companies that sit between existing EHR systems and automate the fax-to-digital workflow. They are not replacing healthcare IT. They are building the translation layer that lets fax-dependent systems talk to digital systems without requiring every hospital to rip out their 20-year-old infrastructure. Here's the contrarian angle. This isn't about technology being better. It's about hospitals finally having financial incentive to fix a problem they've known about forever. The solution doesn't need to be perfect, it just needs to be better than fax and cheaper than replacing the whole system. That's a massive market, because it unlocks workflow efficiency across 100,000 US healthcare providers. Who wins? First, the companies building fax automation platforms. Second, hospitals and insurance companies that reduce their administrative overhead. Third, and most importantly, patients, because referrals move faster, care becomes more coordinated, and complications drop. That's not just humanitarian, that's measurable ROI. What changes next? Watch for consolidation in the health IT space. Once the fax problem is solved at scale, the next bottleneck becomes drug interactions, prior authorizations, and billing delays. But fax automation is the first domino. Within 18 months, expect at least 2 major exits in this category, either acquisition by a larger EHR company or IPO. The larger implication is this. Every legacy system has a fax machine equivalent, a bottleneck that persists not because it's necessary, but because replacing it is expensive and complicated. Healthcare is finally tackling theirs. What's yours? And if you work in healthcare, or you're building in adjacent fintech or compliance, pay attention. This is the template for how to disrupt a broken legacy system without disrupting the entire industry. That's worth watching. 40% of US healthcare still uses fax machines for patient referrals. A patient needs a specialist, their doctor faxes the request, someone manually scans it, enters it into their system, calls back 3 days later. Meanwhile, the patient waits. Meanwhile, the appointment gets delayed. Meanwhile, revenue leaks. VCs are now funding the companies that automate this fax-to-digital translation layer because hospitals finally have financial incentive to fix it. The solution isn't perfect technology, it's building the bridge that lets legacy systems talk to digital systems without ripping out 20-year-old infrastructure. Watch this space. Within 18 months, expect major acquisitions in health IT automation because this is how you disrupt a broken system at scale.